Hi, hello guys. Welcome to Reni's Nursing Academy, Nagarkoil. Hope you all are doing good, staying safe. So today's class உள்ள போறதுக்கு முன்னாடி subscribe பண்ணாதவங்க subscribe பண்ணிக்கோங்க. பக்கத்துல இருக்க bell icon-ஐ click பண்ணிக்கோங்க. So that when I'm uploading my next videos உங்களுக்கு notificationsல show ஆயிடும். So இன்னைக்கு class உள்ள போலாம். இன்னையோட class எது பத்தினு you already உங்க எல்லாருக்குமே தெரிஞ்சிருக்கும். Yes, today is the second part in that vaginal bleeding during pregnancy. That is nothing but Abruptio Placentae. So last class la sonna madriye today's class the continuation of the last class, that is nothing but Abruptio Placentae. This is otherwise called as placental abruption. Both are same only. Yeah, today class la polam. So what is Abruptio Placenta? That is premature separation of the placenta. So it is nothing but detachment or premature separation of the placenta from the uterine cavity. So uterine cavity la irundhu placenta vandu enna agudhu appdin pathina before delivery e vandu detach agudhu, that is separate ஆகி வந்துடுது. Actually this is a serious complication. ஏன் அப்படின்னு பார்த்தீங்கன்னா along with the mother, no, the baby will receive a serious complication in this particular problem because you already know that பாப்பாவை நரிஷ் பண்ணுறதே எதுதான் அப்படின்னு பார்த்தீங்கன்னா பிளாசண்டா தான். ஸோ இந்த மாதிரி பிளாசண்டா டிட்டாச் ஆகி வர்றதுனால பாப்பாக்கு கிடைக்க வேண்டிய நியூட்ரியன்ஸ் O2 எதுவுமே பாப்பாக்கு கிடைக்கிறது இல்லை. ஸோ ஆட்டோமேட்டிக்கலாக the baby will also go into the phase that is fetal distressக்குள்ள பாப்பாவும் போகுது and at the same time மதரும் சீரியஸ் காம்ப்ளிகேஷனுக்கு போகிறாங்க. Here we go. So next என்ன அப்படின்னு பார்த்தீங்கன்னா symptoms. So what are the symptoms you can see in this particular condition? And let me tell you a trick here. So always when you are studying this particular condition, combine this condition with the previous topic, that is placenta previa. So ரெண்டுமே பார்த்தீங்கன்னா more or less ஒரே மாதிரி உல்டா மேனர்ல இருக்கும். So when you are combinedly studying this two, it will be easy for you to study. Okay, so look at the symptoms carefully. So here sudden onset of dark red painful vaginal bleeding will be here. So look at the word painful vaginal bleeding. There when I am teaching about that particular placenta previa, I clearly told that it was painless. So here also the same, when you are receiving such cases, no, shift the patient immediately to ultrasound to confirm this abruptio placenta. So ultrasound shift panni you can confirm do the patient is having this particular problem. The next, and this vaginal bleeding will be very sudden onset இருக்கும். That is also important, highlight that particular point. The next அப்படி என்ன அப்படின்னு பார்த்தீங்கன்னா lower uterine pain and severe abdominal pain will be because as due to severe contraction inside, the patient will be experiencing severe uterine pain there. Then uterus will be rigid and tender. உல்டாவா இருக்கும். placenta previa பார்த்தீங்கன்னா non-rigid and non-tender இருக்கும். But here it was rigid and tender. And finally the baby will end into severe fetal distress. I already told you in the introduction itself, பாப்பாக்கு adequate O2 and blood supply எதுவுமே போகாது. So immediately the baby will go for the phase fetal distress. பாப்பாவோட heart rate எல்லாமே வந்து fluctuating mannerல வந்து இருக்க ஆரம்பிச்சிரும். Then next for this patient, what is the immediate treatment you can give அப்படின்னு பார்த்தீங்கன்னா immediately you can put in a position called left lateral Trendelenburg positions போடலாம். So it is an important position. So abruptio placentaக்கு என்ன மாதிரி positions கொடுப்பீங்க அப்படின்னு கேட்டாங்கன்னா you can go for the answer left lateral Trendelenburg position. When we are putting in that position, no, and right side under hip la you can place a pillow for comfort also. And next என்ன பார்த்தீங்கன்னா immediately you have to start on O2. You already know that papa is under distress. So immediately you have to start on O2 with face mask la immediate start பண்ணனும். The next thing is you can start on IV fluids because there will be a profuse blood loss will be there. So blood loss போயிட்டே இருக்கனால you can immediately start on IV fluids. And another reason for this is the mother will go for hypotension also. So mother oda BP level வந்து கம்மி ஆயிட்டே இருக்கறதால you can immediately go for IV fluids. And if it is needed na you can go for blood transfusion also. HP level is dropping like anything, you can go for blood transfusion. And the next thing is you can immediately post for LSES. So as like patient வந்து already term தான் இருக்காங்க, you can't wait na, you can nearly you can go for LSES immediately. LSES பண்ணி you can save the mother and life of the baby also. And it is considered as an obstetrical emergency. Yes, it is one of an obstetrical emergency because both the mother and the baby are at high risk la irukanga. So kandipa it's an obstetrical emergency. So these are the treatment protocols you can give for this particular abruptio placenta. Then finally the important points. What are the points? What are the key points you can remember அப்படின்னு பார்த்தீங்கன்னா Listen carefully. The first one is it usually occur after 20 weeks of gestation. So as நம்ம placenta previa 12 weeks க்கு அப்புறம் வரும்னு பார்த்தோம் இல்லையா, அதே மாதிரி in abruptio placenta it usually occurs after 20 weeks of gestation. So to peak எப்படி இருக்கும்னு பார்த்தீங்கன்னா 24 to 26 weeksல it usually occurs. So அந்த மாதிரி டைம்ல you can expect this abruptio placenta. So you should be very careful regarding that. The next problem the mother will face is the mother will go for hypovolemic shock. Mother will be going. So due to this profuse blood loss and everything, the mother will be end up with maternal hypovolemic shock that can lead to death also. So serious complication ke எடுத்துட்டு போய்டும். The next problem, so it is one of an important complication here in abruptio placenta is DIC. You already know that, disseminated intravascular coagulation. So mother DIC develop பண்றாங்க, it's all related to blood loss only. Then the mother can develop renal failure. So not only the mother is getting a problem here, the baby also are getting a serious complication here. So complication for the baby includes, first one is fetal distress. You already know that this is due to lack of oxygen and blood supply to the baby. Fetal distress வருது. Then the baby can go for low birth weight baby. So papa பிறக்கும்போது low birth weight baby பிறக்கிறதுக்கு there are so many chances, and preterm delivery ஆகிறதுக்கு high chances இருக்கு, and also still birth can also occur. So these are the important serious complications for the mother as well as baby. I had combinedly give, this is for mother, that is, let me repeat again, hypovolemic shock, DIC, renal failure. This is all for the mother. And for the baby can develop fetal distress, low birth weight baby, preterm labor can occur, and stillbirth can occur. So these are the serious complications due to this abruptio placenta. So இந்த மாதிரிப்பட்ட டாபிக்ஸ்லாம் பார்த்தீங்கன்னா OGல ரொம்ப இம்பார்ட்டண்டாக ஃபோக்கஸ் பண்ணுற டாபிக்ஸ். So go through this topics again. If there is any doubts or for any clarifications, kindly mention in the comments. And I thank you so much, and I hope you all understood this video well. And I will see you soon in my next upcoming videos. Thank you so much. Stay safe. Thank you.